My name is Mohammed El Kadari. I'm an ophthalmologist from Chicago. I'm an adult and pediatric ophthalmologist, and I went with a group of SAMS doctors that went from Chicago. And my intention on the trip was to do pediatric eye surgeries.
The whole thing started spontaneously. That after what's happening in Syria, we want to help. So we formed a group of 8 physicians from the area, and we went the first time to southern Turkey, and from there we went across the borders to areas in Syria. Unfortunately, we cannot go there anymore, so we have been looking for places that we can help, and every year we go on February on a mission trip.
The goal of those trips were helping the refugees. In our capacity as doctors, we helped in some clinics. First trip to Turkey, we helped in a hospital. For a second one, we went to Tripoli, where we helped in clinics. The third one, we were able to go to 3 locations.
Truly, it was a great trip. We were a group of 12 physicians, and that included a lot of specialties, including surgical specialties, ear, nose, and throat specialty, ophthalmology. We had 2 anesthesiologists with us. We had internists, we had cardiologists, and I was the pediatrician in the trip.
Most of the patients we took care of were kids in terms of surgeries. The facilities over there are somewhat limited, but we were able to, take care of the kids, which usually in America would need a pretty specialized facility. So between our anesthesia team and our equipment and our recovery team, which is 1 nurse as opposed to a whole team there, we were able to take care of some of the complicated and cases, and some of the children who are younger, who in America you would not even operate in a surgical center.
Me as a pulmonologist, I saw many patients with pulmonary diseases, so they try to actually concentrate the patients with pulmonary disease. So for me and also my colleague, Dr. Bishar Tuleymat, so we both saw these patients. We actually performed some procedures.
I saw a few cases that I felt that we did a big impact. The patients who had a bronchoscopy, we were able to raise awareness that this patient had possibly lung cancer. We advised them to have surgery. We saw other patients who had pleural fluid collections that we were able to drain and help them out and guide them to the right therapy that hopefully they'd responded to.
It is a wonderful spiritual experience. We gained a lot from this trip, and as it's often true, you gain a lot more than you give.
These are orphans. These are people that would never have these surgeries otherwise because they're quite expensive. One of the great factors is, I've been doing the surgeries on the patients, but now with the new technologies like WhatsApp and Viber, I can see my results. So the patients are sending me the pictures of before and after, and I can tell how happy they are. It even motivates me to go more.
Honestly, I was really touched. I think I benefited more than what I was able to give. I mean, your heart feels warm. You really feel you're part of those people who are suffering. You feel like you really belong with them. We know our hearts are with them from far away, but when you really get on the ground and you really talk to them and help them out, you really feel like this is the right thing to do.
Seeing the very beautiful kids who lost everything in their life, their parents, and they greatly appreciated our visit, and they were preparing for our visit, and they had rehearsal and nice songs to greet us. And so really I need everybody to have a chance to go and share our experience there.
I would definitely encourage everyone to try it at least once. Once you try it, it's very addictive.
I would definitely recommend this. Anybody who has any interest in trying to help people, I definitely recommend going there. It's different when you go there and see it in your own eyes.
The trip was phenomenal. I really think it is really recommended that each one of us should at least try it once in a lifetime.
Any doctor, any healthcare worker should go part of a team and go there, and just by people over there seeing you, they will feel better, and you will hear the stories. It's always different when you see things on the ground.